Hi, my name is Dr. Maisha Barnes, and I'm a gastroenterology fellow at the University of Minnesota. I'm presenting my research, The Histology of Non-Alcoholic Fatty Liver Disease in a Medically Complicated Obesity. Does obstructive sleep apnea play a role? First, I'd like to thank my co-authors, Dr. Henry Buchwald and Saeed Ikramidin in the Division of Bariatric Surgery, Dr. Jose Jesrin in the Division of Pathology, my mentor, Charmaine Stewart, in the Division of Gastroenterology and Hepatology, and our statisticians Jeremiah Mink and Jim Hodges. The reason why I chose this study is because morbid obesity is becoming increasingly prevalent in the United States. It puts people at risk for obstructive sleep apnea and non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a histologic spectrum of steatosis, which is fat accumulation in the liver, to steatohepatitis, which is inflammation associated with steatosis. This can lead to fibrosis and ultimately cirrhosis. Cirrhosis can have devastating complications to an individual and is becoming increasingly a more common reason for liver transplant in this country. As a budding hepatologist, my role is to try and help define risk factors for cirrhosis and hopefully find ways to modify these risk factors. Obstructive sleep apnea is thought to be such a risk factor. In the literature recently, though, there has been controversy as to the actual role. So our aim is to define the role of obstructive sleep apnea in the histology and in the progression of non-alcoholic fatty liver disease. So, our methods. We did a cross-sectional study that compared patients with obstructive sleep apnea and those without, who presented for bariatric surgery. The presence of obstructive sleep apnea was defined using ICD-9 codes. Subjects were recruited from the years January 2006 through October 2010. Analyzed data from a single surgeon was performed with his intraoperative liver biopsies. Patients were excluded if they had previous surgery, if they were on medications that caused steatosis, had significant alcohol use, we couldn't find their pathology, or if they had underlying liver disease. All biopsy specimens were reread by a senior pathologist using the Brunt criteria, which is a validated system well known in the liver world for defining the severity of non-alcoholic fatty liver disease. Our data, we use matched data on the basis of BMI, metabolic syndrome, and age, and defines the metabolic syndrome using International Diabetes Federation definition. So, as far as our results, of the 282 patients that we initially reviewed, we came up with 75 patients with obstructive sleep apnea and 86 controls. Looking at the demographics prior to matching, there were significant differences between those with obstructive sleep apnea and those in the control group. This included, overall, a higher body mass index in patients with obstructive sleep apnea, a higher waist height circumference, as well as lower HDL levels. Also, there was a higher proportion of females in the control group when compared to the obstructive sleep apnea group. Using logistic regression analysis on unmatched data, we found, looking at our odds ratios and p-values and each individual aspect of the Brunt criteria, that there was no significant difference between our cases and our controls. This is throughout steatosis, lobular inflammation, portal inflammation, ballooning. A NASH activity score was also similar between the two groups. This is a bar graph that shows the distribution of underlying disease scores for obstructive sleep apnea in control patients. Again, pointing out that there's no significant difference through each of the sections of Brunt criteria. When we looked at matched data, still there was no difference between cases and controls. Steatosis, lobular inflammation, portal inflammation, and ballooning were similar between both groups. The non-alcoholic fatty liver disease score, or NASH activity, was also similar. So, what this data shows in our conclusion is that obstructive sleep apnea does not appear to be associated with worsening disease in non-alcoholic fatty liver disease. However, given the limitations of doing a retrospective cross-sectional study, certain factors could not be controlled for, and therefore more prospective studies are needed to further characterize this role. Thank you.